I am very pleased to be here to mark Breast Cancer Awareness Month and to discuss this hugely important topic. At the outset, I would like to acknowledge the great commitment of those working in cancer services, in hospitals, screening services and community services, as well as in the charitable and voluntary sectors. This has enabled the continued provision of quality care to individuals during the COVID-19 pandemic and following the cyber attack in May. Cancer prevention is a cornerstone of the National Cancer Strategy 2017 to 2026. Prevention aims to improve the overall health of our population and offers the most cost-effective, long-term approach for cancer control. The proportion of cancer incidence attributable to modifiable lifestyle and environmental factors is estimated to be in the 30 to 40% range. Modifiable lifestyles or environmental risks exist for many cancers. Of these, smoking is the most important. Others include excess body weight, physical inactivity, alcohol consumption and sun exposure. Prevention measures are promoted by government as part of the overall health and wellbeing initiatives under the Healthy Ireland programme. Initiatives such as Breast Cancer Awareness Month bring a renewed and targeted emphasis on prevention. It presents opportunities for us all to promote breast awareness. It spurs us on in our efforts to promote the message across the population that each person can impact significantly on their own level of risk of developing cancer. Breast cancer is the most commonly diagnosed invasive cancer among women in Ireland. It affects approximately 3,500 women every year, as well as a very small number of men. Breast cancer is the second leading cause of cancer deaths among women in Ireland. However, survival rates for breast cancer are improving significantly. Latest breast cancer statistics from the National Cancer Registry show that 5-year net survival for breast cancer patients improved from an average of 70% for diagnosis period 1994 to 1999 to 85% for 2011 to 2015. This represents an approximate halving of the 5-year mortality risk over that time. As these figures predate the introduction of the current National Cancer Strategy and the improvements made in recent years, it is expected that the next set of figures will show a further substantial improvements. The vision of Ireland's National Cancer Strategy is that together we will strive to prevent cancer and work to improve the treatment, health and well-being, the experiences and outcomes of those living with and beyond cancer. It is about preventing cancer across our population, diagnosing cancer early, providing optimal care to people and maximising their quality of life. Each year, approximately 1/3 of all breast cancers diagnosed in Ireland are detected through breast check. I am happy to report that routine screening appointments are now returning to normal in breast check, despite the impact of COVID-19 and the recent cyber attack. Approximately 86,000 women were screened between January and September this year. Unfortunately, due to nearly a year of screening time being lost due to the impact of COVID-19, it will take longer to get through the current screening round. That is approximately 3 years when it normally takes 2 years. However, this is still within international norms, as Ireland screens more frequently than many other countries. People who have been waiting the longest will generally be invited first. The National Screening Service are now working hard to return breast screening to 2-year screening, doing so in a safe manner. It should be noted that even when screening was paused, the programme continued to operate follow-up clinics, providing support to the symptomatic breast cancer services. Additional funding of €10 million was provided for cancer screening in 2021, and this is helping to increase capacity. This investment includes 2 new mobile screening units for breast check located in Donegal and Dublin, with a 3rd mobile also coming on stream in 2022. In line with commitments in the programme for government, Breast Check is currently implementing an age extension project that will see all women between 50 to 69 years being invited for routine breast screening. As with all our national screening programmes, Breast Check delivers its services in line with international criteria for population-based screening programmes that are kept under constant review. As part of Breast Cancer Awareness Month, the National Screening Service and the HSE have launched an extensive national media campaign to highlight key details about symptom awareness, breast cancer prevention and screening during COVID-19. BreastCheck provides lots of information on its website, breastcheck.ie. This includes educational materials to encourage people to be aware of general breast health and information on the common symptoms they should seek medical advice for. All individuals are encouraged to attend for their BreastCheck appointment when they are called. Sometimes people may be a little apprehensive or put off for whatever reason, but it is so important to take up your appointment when it's offered. Early intervention is key. BreastCheck have also launched a campaign which aims to inform the public about any delays in appointments and to highlight COVID-19 protective measures that are in place at screening locations. Before an appointment, a text message from BreastCheck is sent to confirm appointment details. That way, people can rearrange their appointment if needed, and BreastCheck can offer the appointment to another person in the community. Diagnosing cancer at its earliest possible stage is critical. It's a critical first step to achieving higher survival rates, reducing treatment severity and improving the quality of life in patients. Those who recognise features suspicious of cancer and who seek early medical intervention are generally more likely to have less advanced disease, less severe treatment and better outcomes. When cancers are diagnosed at stages 1 and 2, longer-term survival prospects are considerably better than for those patients diagnosed with stages 3 and 4 disease. 5-year survival is 94% for people diagnosed with stage 1 disease and 19% for people diagnosed with stage 4 disease. Each of the 8 designated cancer centres has a symptomatic breast disease clinic, with a 9th clinic operating in Letterkenny University Hospital as a satellite of the service in University Hospital Galway. Approximately 42,000 new patients attend these clinics every year, referred by their GP. From January to September of this year, GP e-referrals for breast cancer are at 130% of the 2019 pre-COVID rate. The National Cancer Control Programme is continuing to closely monitor trends in numbers coming forward to diagnostic services and the level of attendances for appointments for treatment, with a particular focus on urgent cases. The total number of new patients seen across symptomatic breast disease clinics between January to August 2021 is at 98% of the figure for the corresponding period in 2019. Patients are triaged as urgent and non-urgent. Attendances at urgent symptomatic breast disease clinics from January to August 2021 are at 115% of 2019 levels, while attendances at non-urgent clinics are at 82% of 2019 levels. Furthermore, the total number of new cancers diagnosed in symptomatic breast disease clinics from January to August 2021 is at 104.6% of the corresponding period in 2019. So as we can see, all the statistics are going only in one direction. The National Cancer Control Programme is currently developing a model of care for hereditary cancer, covering the identification and assessment of those with possible hereditary cancer risk, referral for counselling and testing where indicated, and coordinated surveillance when required. Increased staffing has been provided to the Hereditary Cancer Service in St James's Hospital, including a consultant in cancer genetics. In November last year, St James's commenced a trial of a remote genetics testing provider with the aim of improving turnaround times for testing during the COVID-19 period. As previously indicated, breast cancer has very good survival rates. People with a diagnosis of breast cancer account for almost a quarter of all those living with and beyond cancer in Ireland. An extra €1.91 million is being used this year to continue the development of survivorship services, including psycho-oncology services, to improve the quality of life of those living with and beyond cancer. An extra €20 million was allocated for the continued implementation of the National Cancer Strategy this year, with €1.8 million allocated specifically for breast cancer services. This funding will drive improvements across all stages of the cancer continuum. Funding of €12 million was also allocated this year for the restoration of cancer services to 95% of 2019 pre-COVID levels. This funding has been used to support hospitals in addressing backlogs, extending clinic times, providing additional clinics, increasing diagnostic capacity and providing locum temporarily support. I am delighted that the commitment of the Government to the implementation of the National Cancer Strategy is further emphasised by the allocation of an additional €20 million in Budget 2022. In conclusion, Nascian Corla, Breast Cancer Awareness Month, I would encourage people to attend for their breast check appointments. And at any age, if you have any concerns about cancer, please go to your GP, who will arrange appropriate follow-up care. As somebody who got that appointment a couple of years ago when I turned 50, I was apprehensive when I went for my very first scan, and I met such a lovely, lovely nurse. I suppose we were all conscious of undressing in public, not in public, but in front of a nurse. But I have to say, it was so important to do it, and when you get your results, it's such a relief. Not everybody gets the results they want to see. But thankfully, though, early intervention is key, and we're all aware of friends and relatives that have had the results that are not as good as they should have been, but they have been able to get the treatment that they need. So I would encourage anyone, and I know all my colleagues here today would encourage anyone who receives an appointment to please go and have the breast check done. It's done in a few minutes, and you will be glad when you have it over and done with. Our cancer diagnostic and treatment services are open. That's the real message I want to give today. Our cancer diagnostic and treatment services are open, and our healthcare staff will provide the care you need. Thank